Clean bag technique.
For our clean bag technique, as long as the bag is leak-proof, easily sanitized, and also has separate compartments, the bag will be great. And a variety of bag styles can be used. If you don't have a bag, that's okay. You can always use a wheeled cart system as long as it has all the necessary features.
Dirty pockets may be entered prior to immediately performing hand hygiene.
So continuing our clean bag technique, we are going to move forward into our dirty pockets. So the first series of dirty pockets are going to be our outside pockets. These outside pockets will be housing our hand hygiene product. And if you are using a wheeled cart system and do not have outside pockets available, then you can always attach your hand hygiene product to the actual handle of the cart system as well. Moving on to the second pocket, the second dirty pocket, which will be usually the front pocket. And inside this pocket will house our barriers, also our hard surface cleaner as well.
Clean pockets must perform hand hygiene immediately prior to entering.
Next compartment, we're going to be talking about our clean pockets. Now remember, before we go into our clean pocket, we will be using our hand sanitizing solution, of course, and then we'll be going into our first pocket. Within this first pocket, we'll have our reusable items, such as our stethoscope, blood pressure cuff, pen light. Also our treatment supplies and PPE gear will be housed in here as well. As far as our clean pockets, I like to have a second pocket where I can house my documenting devices, such as a computer as well.
Entering the home. Treat home as a clinic and perform hand hygiene upon entering and exiting the home.
Now we are going to discuss setting up our workstation. So when entering a patient's home, you're going to have a variety of different settings. You want to pick a clean, dry surface, a hard surface to set up. So some general rules is you never want to place your bag directly on a patient's furniture. And also never on the floor. If you have a wheeled carted system, you're actually able to allow that to remain on the floor. Otherwise, what you would do is you would enter your dirty pocket and you would pull out one of your impermeable barriers. Once you've placed that barrier, you're able to set down your bag, and then you are going to set up your clean and dirty workstations. Now, it doesn't matter what side or which is which, but on the side that you've selected as your dirty side, you're going to place your surface disinfectant and also your hand sanitizer. I also like to have the bag in between the stations, the clean and dirty. Now, I'm going to enter the clean compartment. So I'm going to make sure that I perform hand hygiene first. And this is where I'm going to take out everything I need for the visit. Stethoscope, blood pressure, cuff, pen lights, thermometers, pulse oximeters, whatever you feel you need, any other type of treatment materials that you might need. And then I also like to take out the personal protective equipment that I feel I'll be using during that visit. Remember, it's very important after you're done with compartments that they are zipped up, and this prevents germs and microorganisms from entering that bag, keeping it as clean as possible.
Clean up.
So now that you have completed care, everything that has interacted with the patient during the visit is now considered soiled. So everything from that clean section has now made its way over to the dirty section. So what you're going to do now is focus on cleaning. So you would take your surface disinfectant, you would take the reusable items, and you would go ahead and clean. Once you have wiped down your supplies, you're going to place them down in that back on that clean field and allow them to dry before they are replaced into the bag. You are going to clean even your hand sanitizer, and if you have a reusable surface disinfectant container, you're going to make sure that you're wiping that off too, even if it's going to go back into the dirty section. You're going to place that over there.
Use this opportunity to wipe down the outside of your bag and outside pockets.
Dry. So now that you have performed your care, you've placed all your cleaned items back into the corresponding compartments, you're just going to clean up your workspace. So what you would do is you would take your barriers, you would fold them inward with your garbage here. And then you would dispose of these items or of this garbage as per policy. You would want to make sure that you would never place soiled material back into your bag. If there are any reusable equipment that is not going to be able to be properly cleaned, you are going to bag that separately and carry that out with you. But again, never back into your bag.
Car storage.
When transporting your bag, you're going to consider the outside of this bag dirty. So this is going to be kept in a separate container. Usually in the trunk of the car, but this would be the only thing that is in the bag will be the only thing that's in the particular container.